morning, everybody. My name is Peter Werwine, and I am Senior Editor at Managed Healthcare Executive. And today I have the pleasure of speaking to Paula Bickley, who is Vice President, Market Access Biologics at McKesson. She's speaking to us from beautiful Raleigh, North Carolina. And we're speaking to Paula today in advance of the meeting tomorrow, the 4th Annual PBM Specialty Drug Forum, where Paula is one of the featured speakers. So good morning.
Good morning. A pleasure to talk with you, Peter.
So tomorrow you're going to be talking about putting the patient first. But I took a look at your slide deck, which you kindly sent in advance. And near the end of the deck, you point out that this putting patient first should not be or is not simply a tagline, a cliche, a marketing device. It has some real meaning if we take it seriously. So why did you feel that you needed to remind us that this isn't or shouldn't be just a tagline?
Yeah, great question. And I know that can feel pretty provocative when I say that. And two things. One, it's fairly pervasive in healthcare that a lot of healthcare providers feel that the patient needs to be first and use that to really talk about their essence, that how they treat patients. I want to take it a little bit of a step further because I think the evidence will say, and a lot of what I'd like to present to the audience tomorrow is real factual information that really shows if you do the right thing for the patient and put them first, give them the health care they need, take exquisite care of them while they're under your care and custody, right? It really accrues a benefit chiefly and primarily to the patient, but every stakeholder in healthcare tangibly benefits when the patient is put first. Biopharma benefits, payers benefit, providers benefit, ultimately, and all in the service of the patient. So, that's a bit of a tease, obviously, as to what I'm going to talk about tomorrow, but if you can get the right drug from a specialty pharmacy perspective, the right drug to the right patient at the right time. And again, that sounds a bit like a marketing tagline as well, but really doing that is a formidable challenge. It requires the subject matter expertise of as many as 13 different experts for every patient that face and manage and coordinate care across a variety of stakeholders. So again, I hope that what I can present Friday during the conference is compelling, solid, and really allows people to take away that it's okay to put the patient first. It's okay to provide them the care they need. Even if that means pushing through a lot of administrative barriers, financial barriers, clinical barriers, because at the end of the day, there is a direct correlation, obviously, into their optimized outcome. But there are clear indications that it helps support the strategy of each of these unique stakeholders, and often stakeholders who are really kind of locked in inherent conflict. Providers, payers, biopharma payers, biopharma patients. So again, I'm happy to go into as much detail as you think would be effective today, but really that's what I hope people take away from the conversation we have on Friday.
It's quite a challenge to get 13 different sorts of experts, and I think you list them as, there's business intelligence, there's patient care coordinators, 13 different, to get them to work together. So do you have some notions about how, to get such disparate people working in different parts of the healthcare system to sort of combine in this effort?
From a specialty pharmacy perspective, it starts really long before a new therapy is approved and becomes available. And it's working directly with that biopharma company to help them understand the therapeutic landscape that their new therapy is going to, emerge into, and how payers are likely to respond to their new therapy. Where are patients going to meet? What are the administrative and financial and clinical barriers that are going to meet patients when they're prescribed these therapies? For providers who want to prescribe and need to treat patients with these new therapies, it's teaching them how to originate a prescription completely. What does it take? What does a complete specialty pharmacy prescription look like? What has to come with that prescription so the specialty pharmacy provider can advocate for their treatment decision, can keep that prescription moving one directionally from referral to dispense, understands the underlying diagnosis, understands the goal of treatment, and can help communicate that and convey that to the patient. It takes all of the tactical kind of mechanical things that happen inside a pharmacy dispensing workflow. Specialists who only work on getting prior authorization approval, a whole different group of specialists that all they do is secure financial grants, what financial grants are available to patients. And then obviously once the patient initiates treatment, it requires the exquisite care coordination between our clinical pharmacists, our nurses, and the providers that are out there in the provider offices or hospitals. I'm speaking more to the expertise of everyone who touches these patients, but there is a complex and well choreographed dance that happens to get that patient to initiate treatment.
So there's a lot of discussion and debate, and it's part of our politics now about the high cost of drugs. So is patient-centeredness, or putting the patient first, or right drug, right patient, right time, is it a way of addressing the problem and the challenge of the expense of these medications?
Indubitably, yes. If the patient needs the therapy and there's evidence to suggest that this is the right drug for the right patient at the right time, if we are not, as a caregiving circle, a caregiving, ecosystem, I guess is a decent word, committed to helping them adhere to that. There is clear evidence studied over a long period of time that suggests the cost of non-adherence is pervasive. And in a recent study that we socialize at Biologics, can easily cost our healthcare economy $290 billion annually. In one study, it is clear that non-adherence, if you do all the work to get a patient on therapy, but then you really leave them to their own devices for these complex and often toxic and very costly therapies, to your point. One study suggests that as much as 2/3 of hospitalizations today are driven by medication non-adherence. $100 billion alone spent at a hospital site of service for patients who are there because they did not properly take and manage their oral course of treatment.
Right. And you make a point in your slide deck, which you'll use for tomorrow's presentation, that although adherence is a complicated problem and there's many ways that one can influence adherence, one tried and true and proven way, you know, a big lever on the problem is building a strong nurse-patient relationship. You know, maybe if one were forced to make, you know, to do one thing, that question be, if you had only one thing to do, what would it be in terms of adherence? It seemed that you, Paula, might pick building that nurse-patient relationship as being highly influential on having a great deal of an effect on adherence.
Again, studied often, studied broadly in many different therapeutic areas. And so I think the jury is not out. I think the jury has spoken very clearly that there is something pretty special about a very trusting and effective collaboration partnership between a nurse and his or her patient. If I might, though, as a specialty pharmacy, you know, I want to make sure, and I think most people accept this intellectually, but I'm not sure until I worked and have had now 12 years working inside a specialty pharmacy provider organization. I'm not sure I saw specialty pharmacy as a specialized healthcare provider. I think it's easy to see specialty pharmacy as a put-through organization. Lick it, stick it, ship it. We're good at getting those refills out. You know, it's a production-based kind of environment. And certainly good specialty pharmacies have to be really good at that kind of cycle management. But at its core, specialty pharmacy is a specialized healthcare provider uniquely qualified to handle the very unique and complex and challenges that come with oral specialty treatment. And I'll use cancer, which we all know well at biologics. I'll use that therapeutic area as an example. So it does take the pharmacist, and this may be different at different specialty pharmacies, so I can speak really to a data point of one, but our patients go through a 35 to 45 minute onboarding session with a pharmacist on day 0. We've shipped the product to them, they have it in hand, they're able to open the packaging and all that comes with the packaging and look at the pills and verify the color and verify the size and verify the count. And our pharmacists go through, again, easily a 30 to 45 minute conversation that goes through, helps them understand the diagnosis, the goals of their treatment, the provider's, you know, clinical thinking, certainly talks about dosing, what to look out for, how to dose effectively with or without food, what times a day, how many times a day, et cetera. So, and that's obviously very unique to those kind of clinical pharmacists that really get those first 2 mentions right. The other thing our pharmacists do, and this is really where I think we set our nurses up for success, they go through a multidimensional risk assessment to really understand down to a numerical score, what is the likelihood that this patient is going to have a challenge to comply with their therapy? And it's a multidimensional, covers financial stress, depression, previous treatment, you know, again, not to be too granular, but it's based on that assessment that the pharmacist completes on day 0 that really drives the frequency and the goals of the ongoing nursing care. So, long time ago, 2013, a first-in-class product came to market that was prescribed and indicated for women who had metastatic ovarian cancer. And it was an amazing opportunity for women who had already gone through multiple lines of treatment, different modalities of treatment. They were tired. And this particular therapy had a high pill count, 16 pills a day, big pills. Our nurses, again, based on this just sense that sense and real assessment, risk assessment that the pharmacist did, were really able to meet the patient, again, tired, long challenge with therapy, many prior treatments, and help them learn some tricks on how to take this therapy appropriately. I mean, that's a high pill burden for a tired patient. Take it with milk, head position. And really, if there's, and again, I'm trying to really help this whole concept of nursing and how strongly we feel at Biologics that we really need to do everything we can to promote that nurse-patient relationship. That's the kind of things that happen in those calls. Really practicing head position, chin position. Anyway, the point is, and they set those nurse calls really connect goals and achievement from one call to the next. But anyway, obviously I get excited about talking about it. I'm sorry if I went into kind of a thematic sidebar.
No, I whenever I talk to somebody who's had an encounter with the healthcare system, hospitalization, or I guess typically hospitalization, they often say the nurses were great. And I think it often comes down to those very specific, practical, granular bits of advice or care that help people take their medications, make them more comfortable, that makes a huge difference in terms of the experience of healthcare and its effectiveness. And in this case, we're talking
Peter, and I'm sorry to interrupt. I'm so sorry to interrupt, but just I really want to emphasize that you bring up a very good point, because there's actually studies, some in particular from out of the University of North Carolina, the Lineberger Comprehensive Cancer Center, that the simple act that provides a space for patients to report their symptoms. So the simple act of patient-driven reporting side effect is connected to better compliance, longer time on treatment, longer by 2 months or more, progression-free disease. So the fact that the patient has a forum with a trusted partner, like the nurse that they establish a relationship with and stay with throughout their course of oral treatment, the fact that they get to talk about their side effects and work with a coach that can help them mitigate those side effects leads to more progression-free treatment, more time on therapy, better compliance, optimal outcomes.
We started
data.
We started this conversation talking about taglines and making sure that we don't just leave it at a tagline.
Yeah.
But I'll propose, perhaps people have used this, I'll propose another tagline, that a caring healthcare system is a listening one. So
you should be in healthcare marketing.
I think this has been a great introduction to your talk tomorrow about patient-centeredness at the 4th Annual PBMI Specialty Drug Forum. And I'm looking forward to hearing more tomorrow. So thanks for the time today.
Appreciate it, Peter. I'm honored to have the opportunity. I look forward to it as well. Thank you.